Welcome to Heart Nurses, brought to you by the Preventive Cardiovascular Nurses Association. PCNA's mission is to promote nurses as leaders in cardiovascular disease prevention and management.
Welcome to today's podcast, where we are really grateful to Chloe Villavaso, a clinical nurse specialist from Louisiana. Chloe, why don't you introduce yourself to our audience?
Hi, Geraldine. Thanks for having me. As you stated, I'm a clinical nurse specialist at the Tulane Heart and Vascular Institute, which is the cardiovascular section of the School of Medicine. I've been a clinical nurse specialist for 7 years and a cardiac nurse for 20.
So you've seen quite a lot in your clinical practice, I am sure. And today we're going to focus on some of the things that you've seen, and that is with regard to stroke. So can you tell us, Chloe, what stroke is and what the different types are?
Sure. A stroke or cerebral vascular accident is a disease of the blood vessels leading to or within the brain. There are two types of strokes, ischemic and hemorrhagic. An ischemic stroke is the result of a clot. A hemorrhagic stroke occurs when a blood vessel ruptures. Hemorrhagic strokes can be further categorized as subarachnoid and intracerebral. When a patient experiences neurologic dysfunction caused by focal brain, spinal cord, or retinal ischemia without acute infarct, this is called a transient ischemic attack, or TIA. Geraldine, you may recall a TIA was previously defined by neurologic symptoms that resolve within 24 hours. A TIA is no longer defined by time because of the risk of permanent tissue injury when symptoms last less than 1 hour. Having a TIA increases a patient's risk of having a major stroke.
So I know that our audience and the general public know some symptoms of a heart attack. You see on TV shows where people, particularly men, are clutching their chest, maybe their left arm is aching, and that those kinds of symptoms aren't necessarily the same in women. But how might we recognize someone if they were having a stroke? And if we think they're having a stroke, what should be done?
That's a great question. Symptoms of a stroke include unilateral numbness or weakness in the face, arm, or leg, confusion, trouble speaking or understanding speech, trouble seeing in one or both eyes, severe headache without a known cause, difficulty walking, dizziness, lack of coordination, or loss of balance. Also, Geraldine, all of these symptoms are sudden in onset. The first and most important step if you think someone is having a stroke is to call 911 or activate the stroke team if you're in the hospital.
So you've listed quite a few symptoms. Is there an easy way to remember that?
Sure. Be fast.
Be fast?
Yes, be fast. It's an acronym which guides stroke evaluation. The B stands for balance. Is the person experiencing a sudden loss of balance or coordination? The E stands for eyes. Is the person having a sudden change in vision or trouble seeing? F for face. Ask the person to smile. Look for facial droop on one side. A for arms. Ask the person to raise both arms. Look for downward drift of one arm. S for speech. Ask the person to repeat a simple phrase like, the dog is brown. You should note if the speech is slurred or abnormal in any way. And T for time. Call 911 or your hospital stroke team immediately if you observe any of the symptoms of a stroke. And remember, do not drive to the hospital. Outcomes are most favorable for patients having an ischemic stroke who present within 4.5 hours of the time they were last known to be without symptoms. If criteria are met, treatment includes an IV thrombolytic agent. Patients will have brain imaging such as a CT, CTA, or MRI. In patients having a hemorrhagic stroke, options include anticoagulation reversal, securing a ruptured aneurysm, or placing a drain to relieve intracranial pressure.
So can you tell us, Chloe, what the risk factors are for stroke?
Geraldine, 80% of brain disease is linked to cardiovascular disease, which explains the similarity in risk factors for stroke and heart disease. Modifiable risk factors for stroke include uncontrolled hypertension, which is the number one cause of stroke, smoking, which may double stroke risk in Black patients, uncontrolled diabetes, a diet high in calories, sodium, saturated fat, trans fats, and cholesterol, obesity, physical inactivity, high cholesterol levels, peripheral arterial disease, and carotid artery disease. Having a prior stroke, TIA, myocardial infarction, or sickle cell disease increases stroke risk also. Now, there are non-modifiable risk factors, such as family history, increased age. However, people under 65 also have strokes. Race. Black individuals have a higher prevalence of stroke due to higher rates of hypertension. And gender is also a risk factor for stroke. Women have a higher prevalence of stroke and death from stroke than men.
Wow, Chloe, you've given us a lot of information. We're going to take a brief break, and then we'll be right back to learn more about stroke.
For more education, resources, and tools for your clinical practice, visit PCNA.net. You'll find CE courses, patient handouts, and more, all free to access. Visit PCNA.net.
Welcome back. We're talking with Chloe Villavaso about stroke. And my next question for you is, Chloe, are there any specific heart conditions that can put our patients at risk for stroke?
Yes, atrial fibrillation, coronary artery disease, heart failure, dilated cardiomyopathy, valve disease, and congenital heart defects are also risk factors.
Are there any things that we can offer as preventive measures for stroke?
Geraldine, I'm glad you asked. Considering one person has a stroke every 40 seconds, and stroke is a leading cause of serious long-term disability, prevention is key. Controlling risk factors such as hypertension, diabetes, weight, not smoking, limiting sodium, saturated fat, cholesterol, processed foods, and caloric intake can help decrease the chances of having a stroke. And of course, we can't forget about physical activity. 150 minutes of moderate intensity activity weekly or 75 minutes of a high intensity workout are recommended. Knowing if family members have had heart disease or a stroke can prompt patients to assess their risk and seek risk-reducing intervention sooner. Receiving treatment for AFib, such as anticoagulation or a left atrial appendage closure device, reduces stroke risk.
So, Chloe, you have given us a great deal of information about stroke, and I feel like I have learned a lot. I'm sure our audience has learned a lot. And I'm just wondering if you might have a take-home message as a way to wrap up our conversation today.
Absolutely. The take-home message would be to educate patients and family members on risk factor modification, prevention strategies, symptoms of stroke, and calling 911, not driving to the hospital.
So I've learned from Chloe not to drive to the hospital and to educate my patients on what the signs and symptoms of stroke are so that we can help prevent them and help those that are at risk. Chloe, we can't thank you enough for your time today. We are really grateful that you shared your expertise and helped us learn a lot about stroke. This is Geraldine Warfield, your host, and I will see you next time.
Thank you for listening to Heart Nurses. We invite you to visit PCNA.net for clinical resources, continuing education, and much more.